The contents of this program may not necessarily represent the views of Ummah Channel.
असां ब्रैडफोर्ड ਤੋਂ
तो किसनु थैलासीमिया किसनु है?
हमारे ग्रैंड चाइल्ड को
कितनी उम्र है उसने?
14 साल की बेटी है तो 12 साल का बेटा।
तो जब आपको पता चला कि उनको थैलासीमिया है तो आपको पता था कि थैलासीमिया क्या है?
हमें जिसले ना हमारे बच्चे छोटे थे ना तो उन्होंने बोला थी जिसे तो शादी कर सो ना बच्चियां नहीं उसले ब्लड टेस्ट कराए तो ये जड़ी बेटी है ये मेरे जेठ की है ना तो मैं क्या सी मैं हस्बैंड की मैं है इस ना ब्लड टेस्ट करो वैसे मैं तक्की थे उसकी मैं चेहरा जरा तक्की कर मैं पढ़ लिया सी मैं इसे थैलासीमिया है तो मेरे हस्बैंड ने क्या डॉक्टर जब बातें वो गल सही नहीं होती ना फिर जिसले मैं बेटे की शादी की थी तो मेरी बहू जल्दी प्रैगनेंट हो गई फिर इत्थे जिसले आई तो 4 हफ्ते बाद मेरी जी ग्रैंड डॉटर हुई फिर 3 महीने बाद दसिया ने जे आपके बच्चे नहीं ठीक अगू भी नहीं होने गए तो यह बेटी भी नहीं आपकी ठीक फिर जड़ा ना काफ़ी मतलब साड़ी फैमिली भी काफ़ी हुई इसकी माँ जड़ी उसकी डिप्रेशन हो गया मैं भी बहुत रो नहीं सा तो बस ऐसे ऐसे फिर दानिश भी ऐसे हो गया ये तो बहुत ज़्यादा बीमार सी।
क्या समझने हो कि जेडे साढ़े माँ प्यो नू उन्होंने क्या मैसेज देना चाहना स्क्रीनिंग ज़रूरी है?
ना कि ये मैसेज अपने खानदान चो शादी ना ही करन तो जा पहलू ब्लड टेस्ट करान ना तो जे दोए मतलब है एक करियल है तो एक सही है तो फिर बच्चे चांस है सही होने ना क्यों जी मैं भी अपने चाचे के बेटे के घर हाँ तो हमारे तो बच्चे ठीक नू खाली करियल नू तो दूसरा वाला करियल ना हुआ तो फिर कोई परेशानी नहीं जी बस ऐसा।
जी मेरा नाम सोबिया खान है मैं ब्रैडफोर्ड की काउंसलर हूँ एंड मैं आज
वो काउंसलर नहीं जो सियासी काउंसलर तो नहीं है?
नहीं बिल्कुल नहीं इन रिगार्ड्स टू हीमोग्लोबिनोपैथीज थैलेसीमिया काउंसलर।
तो ब्रैडफोर्ड ज़ाहिर बड़ी कम्युनिटी है हमारी एशियाई कम्युनिटी मुसलमान कम्युनिटी पाकिस्तानी कम्युनिटी कितनी बड़ी इशू है ब्रैडफोर्ड में?
It is quite a big problem actually. We have total about 40 adults and children that have beta thalassemia major. तो उनके साथ ये होता है कि जो beta thalassemia major वाले बच्चे होते हैं adults होते हैं उनको regular treatment चाहिए होती है. So in that case काफ़ी बड़ी issue हो जाती है क्योंकि management का भी issues होते हैं treatment का issue होता है and फिर दूसरी तरफ से ये होता है कि वो जो adults हो रहे होते हैं या बच्चे होते हैं they sometimes have many problems in terms of how to comply with their treatment. So in that sense there is an issue. The other hand ये होता है कि हम कोशिश कर रहे हैं कि अपनी तरफ से कि सबको awareness फैलानी कि थैलेसीमिया क्या चीज़ है and कैसे आती है and we try and promote screening. So initially अगर हमारे पास कोई बच्चा आता है newborn baby या कोई pregnant lady हो तो उनको हम टेस्ट करते हैं फिर उनकी तरफ से ही हम कोशिश करते हैं कि फैमिली जो है उनकी फैमिलीज़ को हम टेस्ट करें सो वी ट्राई एंड इनकरेज फैमिली स्क्रीनिंग थ्रू दैट वे एंड देन एडवांस करते हैं कि हम कम्युनिटीज़ को भी ऐसे ही इन्हांस करें उनकी स्क्रीनिंग का करें। ऑन द अदर हैंड हम कोशिश करते हैं कि हम जीपी जो हैं जब वो पेशेंट्स को रजिस्टर करते हैं उनको भी कहते हैं कि इनकरेज करते हैं कि वो स्क्रीनिंग करवाएँ सो दैट वर्क्स बेटर एक्चुअली शुरू से before anyone gets into the complications of marriages.
क्या मैसेज है आपके लिए कम्युनिटी के साथ?
हम यही कहना चाह रहे हैं कि for the betterment of your family है ना and their future ये simple test है कोई इतना मुश्किल भी नहीं है and instead of going into all these complications and having a major problem ये हम prevent कर सकते हैं something through a simple blood test and you can request that through your GP or through specialist services like us. There are many हम तो ब्रैडफोर्ड में हैं and there are many others around the country. So we would definitely encourage and promote screening.
It's Madiha Ayub. And I'm Sidra Ayub.
Right. Tell me, what do you know about thalassemia and what are your personal experience?
Thalassaemia has affected us as a family. My elder brother had thalassaemia major, and that's how we come about to know about Nibata here, and that's why we've joined here. Thalassaemia is a genetic disorder. It affects the red blood cells, and we've been through a lot in terms of hospital appointments, blood transfusions, and I give a bone marrow to my brother.
You did? How brave it was. When somebody told you that you is the matching bone marrow, how did you think about that? Shall I give or not?
I was too little to think then. I was only 5, so I didn't really know what was going on. But alhamdulillah, it was successful for him and me. Alhamdulillah, I'm well. But I didn't know what was going on at that time. But
And how's your brother doing now?
alhamdulillah, he's fine. He's successful now. He's fine. He's in Medina working now, so as an ICU nurse. So alhamdulillah, we were lucky. We were the lucky ones.
Good. You're here, you're helping and supporting. Tell me what you're doing here today.
I'm helping volunteering here for Nibata. We found out about the society from my brother because Mrs. Rasool, she was there when my brother had the bone marrow transplant. So he found out about the charity from her, and then now because he's gone to Medina, he's told me to help out. And alhamdulillah, we're hoping that it will be more successful. It's a 16th conference. It's been working for 25 years. And we've just been helping out just before the conference as well, making the welcome packs, and now we're selling raffles, and alhamdulillah the proceeds will go towards a charity. And we were really lucky, to be honest, because now they say the bone marrow transplants don't work. The doctors are not willing to carry them out because there's lots of risks. And I think we were very blessed, alhamdulillah, because my brother is totally fine now. You wouldn't know he's got thalassaemia. And my parents did go through a lot though, but alhamdulillah, we've been through the worst.
And finally, what message you would like to give it to community?
Just if your child has got thalassaemia, just try to attend your appointments, and like make yourself aware of the condition. Try to find more information about it. Come to conferences like this, and I know the Bata has like stalls sometimes in Melas. Go there. There's information everywhere. Read on the internet about thalassaemia, what it is, and the more you know, the more you'll be able to deal with it. Inshallah, you will get through it. Inshallah, you will.
It's my pleasure now to introduce Dr. Kate Ryan, who is consultant hematologist at Manchester, and she's going to be talking about cardiac problems.
Thank you. Can you hear me all right? I'm actually presenting this talk on behalf of my colleague, Dr. Dormand. Dr. Dormand is a cardiologist or a heart doctor who's started been in post now for probably a couple of years at the Manchester Royal Infirmary, and we're working together to build up and strengthen our cardiology thalassaemia service, and I'll talk a little bit more about that later. Okay, so in the talk today I'm going to give a bit of an introduction, transfusions and whether blood is safe and free from viruses, as in the UK and Europe. The problems with the heart are probably still one of the leading causes of death. So it's very important to get it right. Okay, so you probably have also seen or heard this fact, but every time you have a unit of blood, and by a unit of blood I mean one bag, that contains about 200 milligrams of iron. And to put that into perspective, a typical adult female like me would probably need about 1 to 2 milligrams of iron a day for health. So just having 1 unit of blood gives you about 200 times what I would need in a day. And the problem is that our bodies are not very good at getting rid of iron, and so over time this iron builds up in the blood and it gets deposited in various organs, and particularly it gets deposited in the heart. Causes damage to the heart and inflammation of the heart muscle. So when we're treating thalassaemia patients, it's a compromise between obviously giving you enough blood to keep you healthy. If we don't give you enough blood, and that makes the heart work faster anyway, but also when we do give you the right amount of blood, we're actually giving... Okay, so the heart has a couple of important functions. First of all, we have electrical circuits in the heart. So these, electrical signals down from the top of the heart through a sort of internal wiring system down to the pumping chambers of the heart. So you'll see on this diagram there are two bits at the bottom, two holes if you like, and these are what we call the ventricle pumping the heart. And the heart, these spaces are surrounded by very strong muscles, and these muscles squeeze to pump the blood around the rest of the body. So we have a normal heart rhythm, and we can do something called an ECG. Many of you in the room, many of the patients will have had an ECG, and that is a way that we can actually look at the electrical circuit within the heart. When we look at ECGs in people with thalassemia, we see quite a few minor abnormalities on the ECG, but this doesn't necessarily mean that the heart is going to fail. You can still have a good heart function with a slight abnormality on the ECG. So I'm just having trouble reading. Okay, so after deposition of iron in the heart, the electric circuits can be interrupted, and this causes problems with the heart rhythm. In particular, it can cause the heart to beat irregularly or the heart to beat very fast. You will know this as palpitations. And these heart rhythms can be coming from the top of the heart, or they can be coming from the bottom of the heart. But when the heart rhythms that go wrong, particularly affecting the bottom part of the heart, the squeezing chambers, that can actually stop the heart from actually pumping out blood. And so this can be a major problem with the heart rhythm change. What about the pumping action of the heart? Well, the heart enlarges slightly because it's actually got to pump blood around the body, and people with thalassemia are anemic some of the time. So the heart is actually very efficient. It actually pumps a bit more blood than normal, and when we measure this, we can measure it by something called the ejection fraction, and that is normally a little bit higher than normal in a typical thalassemia patient. When you get iron in the heart, it gets deposited in the heart muscle and prevents that muscle or that pump from working. And when that pump doesn't work properly, what happens is you get a build-up of fluid, and you get a lack of blood going to vital organs of the body, and we call this heart failure. So the fluid can build up in the lungs, affecting your breathing, and actually can also cause heart rhythm problems. So what can we do about this? Well, as we've heard in the previous speaker, the obvious thing is to prevent iron building up in the heart, and that's about iron chelation. But what we do in the clinic to monitor whether the heart is affected by thalassemia is to first of all ask you if you've got any symptoms. Are you experiencing any breathing problems? Are you getting any palpitations? We can look and monitor by the heart rhythm by doing an ECG or the heart rhythm tracing. We can also do a test called an echocardiogram. This is like an ultrasound scan of the heart. This tells us how well the heart is pumping, how well it's producing, what sort of volumes of blood it's able to pump out. Sometimes if people are having palpitations, we can do a longer test than an ECG. We can actually put a monitor on you, and we can actually see what sort of palpitations they are. The treatment, if we have heart problems, as I say, first, well, the moment we really wouldn't want you to get to the state of having heart problems, but we need to make sure that we keep the haemoglobin at a good level, so we're not putting too much stress on the heart through anemia. If you do have rhythm disturbances, palpitations, we've got various drugs that can control this. And if you're unfortunate enough to have heart failure, we have various drugs that can help the heart to squeeze the blood around. This picture just shows you a typical ECG and a typical machine that we use to look at the pumping action of the heart. Now, most of you will have heard over the years about a technique called an MR scan. Now, iron is magnetic. I don't know if any of you remember those iron filings experiments at school. But because iron is magnetic, you can use a magnetic resonance scanner to actually help you decide or see whether there is any significant iron in the heart. This technique has been around for quite a long time now. It's used very widely throughout the world and it is very accurate. It doesn't involve having x-rays, so it's not dangerous to have repeated tests. And it's actually probably the best way that we have of telling us how the heart is pumping and very importantly how much iron there is in the heart. So when we do these tests we come up with a value, and those of you who come to the adult clinic I will tell you what the value is and what we should be aiming for. So ideally we don't want any iron in the heart at all. We want a T2 star that's over 20 milliseconds. And we know that if your heart value is below 10 milliseconds, that puts you at very high risk of developing heart rhythm disturbances or heart failure. So I get very worried when I see a T2 star below 10, and that would certainly be an indication to review your iron chelation and make sure that you are having the maximal doses. The good news is that when you do have iron in the heart, and when you do have use your iron chelation, we know that we can reverse this. We can remove the iron from the heart. So all is not lost if you have a bad T2 star, but it takes a long time and it's a long process, and obviously we'd rather we didn't have to do it in the first place. So I just want to finish by telling you what we're doing in the Manchester Royal Infirmary. We are a regional centre for thalassaemia care. We see adults and children from all over the northwest. And starting from about 2 years ago, we set up a combined cardiology, haematology clinic. These sorts of clinics have been running very successfully down in London for some years. But this was the first time that we managed to set up such a clinic outside of London.
Right, what we've got on Facebook is something called groups. Now, I've been doing some research on this. There is a thalassaemia support group, a thalassaemia UK support group, beta thalassaemia support group, and various other groups on Facebook. Now, you need to go on your groups for here, and when you search on these, you just by entering thalassaemia or thal, it brings up loads of groups. Now, one of the benefits of joining a group is you gain knowledge from all the other people that post in the group. For example, sorry, let me just go back. So in the groups, you can have a closed group or an open group. Now, if it's an open group, that means your posts on that Facebook group will be shared and viewable to see by anybody. If it's a closed group, that's exactly what it means. So your views will just be specific to that group. So if you're frightened of putting anything about your thalassemic experience on one of these groups, then always go for the closed group. Thereby your post will be protected. It's very interesting to see other entries in these groups from different countries, as far as India, Pakistan, to like Germany, France. There's loads of obviously, so you can mix with a lot of thalassaemic patients around the world. It's very interesting to ask questions on this, because if you ask a question, lots of people will respond with their views, their experiences, so thereby you gain knowledge. One of the posts recently was about, why is my HB always falling? I receive 4 units of blood, I get transfused, but my HB never rises. And a lot of people put on there, maybe your pre-transfusion level is low, or you're not getting the right blood, or the blood that you're receiving, it's not fresh enough. So things like this are on Facebook, and you can be as personal or impersonal as you choose. Obviously there's certain questions that you might want to ask, direct them to certain people, and you can also befriend people on Facebook just as you would friend somebody else in your school or college. So it's a very good tool, very powerful. I haven't set a group up myself, which I don't see the need, but the ones that are already there are quite valuable. There's also Twitter, which I don't know if anybody uses that. I certainly don't really use it as much. But UKTS, TIFF, Nabata, have all got, like, you can tweet on there as much as you want. But that's not really getting down to personal experiences. The Facebook groups allow you to express any personal experiences that you have. So it really is powerful, it really is good to do that. And some of the feedback, some of the questions you get back, some of the replies you get back, you'll probably all be aware of, oh yes, I've got my pump on, I'm putting it on this side, or putting it on this side. People, you can ask questions, and you can friend a lot of people as well this way, and you can get to know them, maybe even meet them on international conferences. So it is really a powerful tool, and social media allows you to express yourself in that way. I find it very, very good in the sense that I've used I've put a lot of posts in there, replied to a lot of people, got a lot of feedback. You can even share pictures. So you could, if you went to your vampire session one day, you can have your picture of your blood up, and a lot of people would comment on that, saying, yeah, well done, you know, you're in for your good juice, etc., etc. So it's worth sharing your experiences and being part of the group, and it's really, really good for your heart, because it's a common ground, sharing your experiences, sharing a common thing, and in some ways, you don't have to put your picture up there, you don't have to do anything, and you can get information back and think, yeah, why didn't I try that? Or why is that working for somebody else? Why, you know, it might work for me. So you can be, it's just a very good way of doing things. On my phone at the moment, I'm subscribed to 4 groups. One of the best ones that I think is the Thalassaemia support group. I'm going to try and read something off from here if I can find it. Let me just give it a second. See, like this one here. Somebody's put here, I went from 3 units every 4 weeks to 4 this year, and this is not having no effect on my pre-transfusion. The HB still drops to 80, 85. So obviously he's got 21 comments on there. So 21 people have replied to that. Giving maybe suggestions as to why his HB may be falling down. I mean, my comment on that, I put a comment, I think, if I can find it. Something about having a spleen. Maybe the spleen's taking his blood. Obviously, it's not medically, there's no medical sort of people that are maybe replying to this, unless you know it's a doctor. But maybe that's getting to that realm of going into clinics and stuff. Maybe you don't want to put that. It's more for sharing experiences. Thank you.